Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the osteology of the scapula and the clavicle. Right, the clavicle and the scapula forms the shoulder girdle. So the shoulder girdle is actually made by the clavicle and the scapula. Let's start with the clavicle. Right, so the clavicle is a long bone, the only long bone in the body that is horizontal, is the first bone to ossify, and it ossifies by membranous ossification, right? And the clavicle has no medullary cavity. It has no medullary cavity. Um, Medially, the clavicle is going to articulate by the first costal cartilage and the mandibular sternum via what's called the sternoclavicular joint. Then laterally, the clavicle is going to articulate by the acromion process via the acromioclavicular joint. Let's take a look deep on the clavicle. Right, so your clavicle is actually S-shaped like this. This is your medial, so your medial is going to be called your sternal end because it articulates with the sternum. This is going to be called your acromial end because it articulates with the acromion process. Right, so this is a superior view of the clavicle. This is an inferior view of the clavicle. Superior view of the clavicle is actually smooth. So the superior border of the clavicle is smooth. The inferior border is rough. You understand? Good. So the clavicle is actually going to be attached to certain muscles, right? So right here at the medial, at the medial portion, you're going to have the clavicular origin of your pectoralis major muscle, and then at your posterior medial portion, you're going to have the attachment of your sternocleidomastoid muscle, and then at your lateral anterior portion, you're going to have the attachment of your deltoid, posterior lateral portion, attachment of your trapezius muscle. Take note of this. The clavicle, if it is seen in this orientation, is going to be divided into thirds. So you're going to have a medial two-third and a lateral third. So a medial two-third and a lateral third. Take note of this. The medial two-third anteriorly is convex forward. The lateral one-third anteriorly is concave forward. Right? Good. So concave just means that bowel shaped, right? If you look the interior aspect of the bowel, that's concave. The exterior portion of the bowel, that is convex. So true or false, the clavicle is concave laterally, concave forward laterally. That is true. You can actually see the concavity right here. Right. So let's take a look at the inferior portion of your clavicle. The inferior portion of the clavicle is actually going to have impressions. Like I said, it's rough. So let's take a look from medial to lateral. You're going to have an impression for the costal clavicular ligament. At the middle portion, you're going to have a subclavian groove for the attachment of subclavius muscle right here. Laterally, you're going to have the attachment for the coracoclavicular ligament. So the coracoclavicular ligament is going to be made by the trapezoid ligament right here and the conoid ligament right here. Let's take a look at these ligaments. So right here, you can actually see this is your costal clavicular ligament. which attaches from the junction of the first rib and its costal cartilages and attaches the inferior portion of the medial portion of your clavicle. Laterally, you're going to have these ligaments. Together, the trapezoid ligament and the conoid ligament are called coraco-clavicular ligaments. This ligament is actually an accessory ligament which supports your acromioclavicular joint. You understand? So these ligaments, they will be attaching the inferior lateral portion of your clavicle to the coracoid process of your scapula. So that's the attachment of your coracoclavicular ligament. Let's take a look at the fractures of your clavicle. Now let's take a look at the fractures of the clavicle. So right here, this is your clavicle. You can actually see medial two-third concave, convex, forward, concave, backward. Lateral one-third, concave, forward, convex, backward. Right. So like I said, the clavicle is divided into thirds. So as for the purpose of this lecture, we're going to divide it into 3 thirds, a medial third, middle third, lateral third. So take note of this. In the fracture of the clavicle is the most commonly bone in the body to be fractured because it actually supports the wall of the upper limb towards your axial skeleton. So the most common point for the clavicle to fracture is the junction between the lateral third and the middle third, or the junction between lateral one-third and the medial two-third. Let me repeat. The junction for the fracture, the most or the weakest point of the clavicle to fracture is the junction between the middle third and the lateral third, or the lateral third and the two third or two medial third. You understand? So that's where the clavicle is going to fracture at this point. So when it fractures, you're going to have a distal, a proximal segment, and a distal segment, or a medial segment or a lateral segment. So when it fractures, the proximal segment is actually going to be elevated due to the attachment of the sternocleidomastoid. The distal segment is actually going to be depressed due to the muscles due to the weight of the upper limb. You understand? Good. So the distal portion depressed, proximal portion elevated due to the due to the attachment of the sternocleidomastoid. Let's take a look at the osteology of the scapula. So I said the shoulder girdle is made of the two bones, the clavicle and the scapula. Now let's take a look at the scapula. All right, so a scapula is actually a triangular bone which is going to have 3 angles. It's going to have an inferior angle which is mainly palpated in a normal patient. You can actually palpate it. A superior angle and a lateral angle. Your scapula extends from the 2nd rib to the 7th rib. So the superior angle lines with the 2nd rib, the inferior angle lines with the 7th rib. Right. So the scapula is actually going to have 2 borders, a medial border and a lateral border. The medial border is slender and sharp. The lateral border is thick, as we're going to see. We're also going to have a superior border, right? So the superior border laterally is going to extend to form what called the acromion. The acromion, the one that is going to articulate with the acromial process of the clavicle, and then it's going to have a tuberosity called the coracoid process. On the superior border, we're actually going to have a scapular notch. You can actually see that the scapular notch is converted into a scapular foramen by what you call a superior transverse ligament of the scapula. Take note of this. Within the foramen, you're going to have the suprascapular nerve. Above the foramen, you're going to have the suprascapular artery. NB, the suprascapular artery is outside the scapular foramen. You can use a mnemonic code. Army moves above the navy, right? Army above, navy below the bridge, right? So army above the navy. Army walks above the bridge, navy below the bridge. So army for the artery, suprascapular artery. Navy for the suprascapular nerve. You take note, right? Good. Posterior to your scapula, you're going to have two fossa, a supraspinous fossa and an infraspinous fossa, separated by the spine of the scapula. Right. Take note, the spine of the scapula, it is aligned by T3. Aligned by T3. Good. The spine of the scapula will actually divide your scapula into supraspinous fossa, infraspinous fossa. Supraspinous fossa is going to be attached by a muscle called supraspinatus, which we spoke of in our humerus osteology. Infraspinous fossa is going to be attached by the infraspinatus muscle. Good. Let's take a look at the anterior portion of your scapula. So the anterior portion of your scapula, or in other ways, the costal portion of your scapula, because it lie on the costal wall. It's going to be concave, right? And it's going to be called the subscapular fossa. The subscapular fossa is going to have or accommodate the subscapularis muscle, right? The rim of this subscapular fossa, you're going to have the insertion of the serratus anterior muscle. The serratus anterior muscle. You understand? Let's take a look at this portion of the scapula, the lateral ankle, which forms the glenoid cavity. So the glenoid cavity is actually going to receive the head of the humerus, forming the glenohumeral joint. Above this glenoid cavity, you're going to have a tubercle, which is called the supraglenotubercle. The supraglenotubercle is for the attachment of your long head of the bicep muscle. Below it, you're going to have an infraglenotubercle. An infraglenotubercle for the attachment of the long head of your tricep muscle. Right. Let's take a look at the muscles that attach to the scapula. Right. Muscles that attach to the scapula. Here, this is medial border, lateral border, superior border, triangular shape. What are the muscles that attaches to the anterior portion of the scapula? This is your subscapularis fossa. Is going to have the This is your subscapular fossa. Is going to have the subscapularis muscle. The rim of your medial border anteriorly, you're going to have this serratus anterior muscle. This is your glenoid cavity. Above your glenoid cavity, you have the supraglenoid tubercle for the attachment of the long head of the bicep. Below the glenoid cavity, you have the supraglenoid tubercle for the attachment of the long head of the tricep. Right? This is your coracoid process. The coracoid process receives the following muscles: the short head of the bicep, the coracobrachialis, the pectoralis minor, and the coracoclavicular ligament, which we spoke about. Right here is your posterior view of your scapula. You have the spine of the scapula separating the suprascapular fossa and the infrascapular fossa. The suprascapular fossa, you're going to have the supraspinatus muscle. Infraspinous fossa, you're going to have the infraspinatus muscle. In the lateral border, you're going to have this, the long head of the tricep attaching to the infraglenoid tubercle, the teres minor, the teres major, and in the inferior ankle, you have attachment for the latissimus dorsi muscle. In the medial border, posteriorly, you're going to have the rhomboid major, rhomboid minor, and the elevator scapulae. Thank you so much. See you next time. Take care.